Hello, my name is Dr Rachel Hill-Tout. I work in the Courtyard Clinic at St George's and I'm a specialist registrar in sexual health and HIV. So I'll be giving a presentation today talking to you about getting older with HIV, challenges and the opportunities. And it's a huge topic. I'll really just try and cover some of the important medical, psychological and social aspects of getting older and try and give some practical advice and tips about getting older well and living well with HIV as we get older. So I thought I'd just start with a quote from an HIV patient, and this is really reflecting some of the bad old days of HIV when we were very used to people not making it till they were older, people who were dying when they were very young, and I think we're now in a very exciting time where people are living older and growing older with HIV. And the quote says, I've been getting very cross with articles that emphasise how people with HIV are going to die 10 to 15 years younger and be sicker than the average person if we do survive. I'm now 70, I still go dancing every week, and my recipe for a long life is always to think positively and refuse to be a victim of HIV. So I think this is a good place to start. I would say the future is bright, getting older with HIV. I think the very fact that I've been asked to give a talk on getting older with HIV is a very, very positive aspect, because 20, 30 years ago, people were not getting older with HIV. They were dying very, very young. And now with the advent of highly active antiretroviral therapy and the new excellent treatments we've got now that have very low toxicities that are much easier to treat, people are doing extremely well. And certainly a diagnosis of HIV now doesn't mean that you shouldn't be living a long and fulfilling life. And really, according to the most recent studies, we can see that being diagnosed with HIV now, except in a few cases where you're diagnosed extremely late, you should expect to live just as long as a person who is HIV negative, which is a really remarkable thing to say and should inspire a lot of confidence in HIV positive patients. The fact remains that now HIV patients are getting older and suffering a lot of the medical problems that HIV negative people suffer because they're living longer. And the good thing about that is there are a lot of things that you can do on an individual level and that your clinic and your GP can help you with to take care of yourself, feel fitter, be healthier and live longer. In the things I'll talk about in the presentation, if there's anything that you've got questions about, I'm happy to take questions. And also your HIV team will be happy to answer any questions you've got on any of the issues raised here. So in terms of some of the statistics about people living with HIV in the UK, the number of people living with HIV in the UK has continued to increase steadily. From a decade ago, the number of people living with HIV has doubled. It's now over 80,000 people, and this was data from 2013, so it's probably higher than that still. And the number of people living with HIV is increasing year on year, mainly because people living with HIV are living longer. It is also increasing at a small degree because we are starting to diagnose more people with HIV in the older age ranges, but it's mainly because people are living longer, and that's because they're being diagnosed earlier, they're being put on effective treatment, and they're living very, very well. In terms of older people with HIV now, in the most recent figures from 2013, we can see that just about a third of patients were aged 50 years or over. So that's quite a massive proportion. Nearly 1/3 of people living with HIV in the UK are 50 or over. And that proportion was double the proportion of people who were 50 and over in 2004. Just about half of people living with HIV in the UK at the moment are aged 45 and over. So this is a graphic from Public Health England. And you can see the bars we're interested in are the blue coloured bars. This shows the number of people diagnosed with HIV seen for HIV care by age group in the UK from 2004 to 2013. So people aged 50 and over, they're represented by the dark blue bars at the top. People aged 35 to 49 are in the red bars. And then people aged 25 to 34 are in the sort of turquoise bars. So you can see the number of people in the turquoise bars, that's sort of 20s, 30s range. The number of people living with HIV has remained relatively stable. But it's in the red bars, the 35 to 50, that's really getting bigger, and also in the blue bars of the over 50s. So we can really see that people are living longer and they're moving through those age ranges. So they're surviving into their 40s and their 50s and beyond. And that's really, really encouraging data. So more good news is that the death rates are falling for people living with HIV. And data from Western Europe, Australia, and the US have shown that overall death rates have been falling. And this is data from 2011-2012. They've fallen by nearly a third since 1999. That's overall death rates. And death rates specifically from AIDS-related causes have dropped by 1/3. Cardiovascular events such as heart attacks have fallen by 2/3, and deaths from liver disease have nearly halved. So again, really, really positive news. What we'll talk about now is a little bit about the medical and then later the psychological and social issues about getting on with HIV. I think it's fair to say that as people get older, HIV positive or negative, they are likely to experience more health events. And as I said, that's the same really for whether you're positive or negative, but being HIV positive, you may have slightly more risk of experiencing health events than someone who is negative. And it's important to talk about these. That's what we'll cover today. Some of the health issues that might arise as you're aging with HIV are specific to HIV and are not experienced by HIV negative people, but actually the vast majority of issues are issues that are experienced by both HIV positive and negative people, but they might affect HIV positive people slightly earlier in their lives, or HIV positive patients might experience them more frequently. One of the really positive takeaway messages from this, I think, is that many of the risk factors that cause ill health with ageing are actually within your own power to change. And really, these are things that can be picked up early if you're in communication with your HIV team and with your GP. These risk factors causing ill health and in ageing can be picked up early and managed so that actually you're not progressing to things that cause you real trouble. And we're talking about things like heart attacks, strokes, kidney disease, things like that. So there's a lot of things that you can see your doctor about and get help with. There's also important changes you can make yourself, things like choices in your diet, choices about smoking, choices about exercise. So we're going to cover a little bit about the medical issues, but we will also touch on psychological and social issues, because we know that growing older, whether you're HIV positive or negative, can lead to certain worries, certain stresses, things about money, relationships, how you'll be looked after as an older person, and we'll look at those a bit later as well. So this is a big topic, but in terms of some of the important medical issues that older HIV patients might face and things that we would certainly look out for in the clinic in terms of keeping you healthy, a really important thing is cardiovascular health. So that's the health of your heart and your important blood vessels. And that's all related to your blood pressure, your cholesterol or your soluble fats in the blood, your body weight. All these things are tied in together. And this ultimately is going to lead to an increased risk or a lower risk of things like heart attacks and strokes, which are an important cause of death both for HIV positive and negative people. Another issue as we get older is the issue keeping your bones strong and healthy, avoiding serious fractures, avoiding falls, because as we age, our bones get more fragile, we're more likely to incur fractures, and in HIV, that rate is slightly increased, so we must take care to look after bones and keep them strong. Keeping a good kidney function is important, and kidney function is something that is routinely monitored in your HIV clinic almost every time you come to see us. So we keep a very close eye on that, because that's something that can deteriorate with age in HIV positive patients and negative ones, and it's a critical organ, so it's important that we look after that organ very well. Again, an important issue with aging is changes in your memory, and that's something that can be a real worry for people, that can really affect someone's independence, and that's something that both us in the HIV clinic and your GPs will be very vigilant in picking up, and we'll talk a bit about memory loss. An important cause of death for all people, particularly older people, and particularly older people living with HIV, is cancers. And it's important that any cancers are picked up early, detected early, appropriately diagnosed, and we get on with treatment and management as soon as we can. And then lastly, we'll touch on drug interactions, because as people grow older, they're likely to have more medical conditions diagnosed, and they may be prescribed more medications for these, and there's a greater potential for interactions between their different medications. So we'll touch on high blood pressure and cholesterol. These two factors are very important in terms of your overall risk of developing heart disease, atherosclerosis, which is lining of your arteries with fatty plaques, and ultimately a risk of heart attack and stroke. And these can be fatal events, and if not fatal, they can seriously affect your quality of life. Two of the major factors that affect your blood pressure and your cholesterol are what we call lifestyle factors. Important things in lifestyle factors are your body weight or your body mass index, the amount of saturated fat in your diet, the amount of salt in your diet. These are extremely important factors that can drive up your blood pressure. Even just losing weight on its own without any other changes will show beneficial improvement in blood pressure. But conversely, being very overweight will push your blood pressure up, and that can really lead to quite a strain on your blood vessels in your heart, which can affect the ability of your heart to pump effectively. Just with getting older, blood pressure is likely to rise. And so even if you're very, very fit and healthy, just by the effect of getting older each year, your blood pressure may rise a little bit. That's why it's important both for us and your GP to continuously keep an eye on the blood pressure, and that's why we check it every time you come to clinic. It's really important to involve your GP in things like blood pressure and cholesterol, because they can link you into specialists, they can refer you, and they're very good at following you up, monitoring your blood pressure and your cholesterol, and they will be involved in prescribing the medications if necessary to treat both of these factors. They can also help with advice on exercise and diet. They can refer you to a nutritionist, as can we, but your GP can also help with referring you to a gym, for example, in certain situations to help you with exercising and keep the weight under control. Now, as we get older, our risk of heart disease goes up. People living with HIV do have a slightly higher risk of heart disease than people who are HIV negative. So it's really, really important that both your HIV team and yourselves are really proactive in addressing this, because this is a major cause of death for all people, HIV positive or negative. Now, the reasons why people living with HIV have a higher risk of heart disease is really multifactorial. An important issue is that we believe that in HIV there is some ongoing chronic inflammation, and this can affect the way your vessels function, and laying down of fatty plaques in the arteries can be slightly increased when there's more inflammation. So that process of fat being laid down in the arteries, which we call atherosclerosis, may increase the risk of clots, which may increase the risk of heart attacks or strokes. In HIV, we know that there can be changes in what we call the lipids. This is the amount of soluble fats in your bloodstream. And in HIV patients, we do see that often there are higher triglyceride levels, which are the bad fats, and lower HDL cholesterol, which is the good cholesterol, which is more protective. And this imbalance can increase the risk of fat being laid down in the arteries and of clots as well. We know that there may be higher rates of poor kidney function in HIV positive patients, and that can lead to high blood pressure, which, as we talked about before, can also lead to a strain on the heart. Probably one of the most important factors, though, in cardiovascular disease is smoking. And we know that in HIV positive patients there is a higher level of smoking than there is in the general population, and that is a major risk factor for cardiovascular disease, just on its own, without any of those. And that's a factor that's within your power to control with the appropriate support, of course. So in terms of tips to reduce your risk of heart disease, cardiovascular problems and stroke, the recommendations would be a healthy diet, something that includes oily fish or omega-3 supplements, because that's known to reduce the risk of heart disease, maintaining a healthy body weight, good blood pressure measurements with treatment if necessary, and a diet that's low in saturated fat, low in salt, a sensible level of alcohol, not excessive, and a good level of fibre in the diet as well. Regular exercise, we're talking about at least 20 minutes every day, even if it's just walking, will really, really help. And stopping or at least cutting down smoking will make a massive impact in reducing that risk. And probably cardiovascular risk for our current HIV population at the moment is probably the most important things for us to address. These are the things that are really affecting people and their health as they grow older at the moment. Now, I mentioned smoking, and probably if I was going to really emphasise anything in this presentation, I probably would emphasise smoking, because it is such an important risk factor for heart disease and for risk of mortality or risk of death generally. And this is particularly the case in HIV patients, but it's also a big risk factor for death in HIV negative patients. Now, approximately 20% or less of the population in the UK smoke, but it's up to 47% of HIV positive men smoke in the UK, so quite a significant amount more. And this is an important reason why HIV positive patients may experience higher levels of heart disease and things like lung cancer, because the level of smoking is higher, and it's a very important factor. Now, smokers who are HIV positive are more likely to have deaths from cardiovascular disease and non-HIV related cancers. And this statistic was very interesting. It's the life expectancy of an HIV positive 35-year-old man who's undetectable and stable on treatment. If he's a smoker, his life expectancy will be reduced by 8 years compared to the equivalent HIV positive man doing well on treatment who's not a smoker. So it's quite significant. And as expected, the older you get, the worse the impact of smoking is on your health. So every year you get older, the more we would encourage you to cut down, because your body gets increasingly under more strain, and it's more beneficial to stop smoking. Talk briefly about bone health and osteoporosis. So osteoporosis is how we refer to bones that become weak and easy to break, and this increases your risk of fractures. This can be very debilitating and can lead to a loss of independence for a lot of people. Now, the risk of osteoporosis goes up as you get older. It's also higher in people living with HIV, and this is likely to be a combination of the HIV virus itself, and may also be related to some HIV medications which are used to treat the virus as well. It does tend to be more common in women than men, and more common in older women. The other things that will increase your risk of fragile bones are poor diet, low levels of activity, and being a smoker as well. So tips to reduce the risk of fractures would include a healthy diet that's got plenty of calcium and vitamin D, and often, drinking milk or dairy products will certainly give you that. Doing any weight-bearing exercise, even if that's just walking, can help make bones stronger and reduce the rate of bone loss. And a healthy weight is very important, because we know that people who are very underweight or people who are very overweight are much more likely to get fractures. If you're lucky in the UK, you might get 20 minutes of sunlight every day. That will help expose you to the vitamin D that's necessary for healthy bone formation. And again, stopping or cutting down smoking will really help increase your bone strength as well. So one thing that's important to talk about is cancer risk as we get older, and cancer risk particularly in HIV patients. Now, we know that people living with HIV do have a slightly higher risk of cancers than people who are negative. There are certain cancers that are specifically related to HIV, and in HIV positive patients, their risk of these cancers is a lot higher. We're talking about things like Kaposi's sarcoma, non-Hodgkin's lymphoma, and cervical cancer. And really, these things were very, very common before we had highly active antiretroviral therapy. We saw a huge number of cases of these form of cancers. Fortunately, now that a large majority of HIV positive patients are on treatment, we see much, much fewer of these cancers, which is really good news. Even so, people living with HIV are more at risk of other cancers which are not specific HIV-related cancers. These include anal cancer, liver cancer, and lung cancer, importantly, and Hodgkin's lymphoma. HIV patients don't have particularly higher risks than the general population of common cancers such as breast cancer, colorectal cancer, or prostate cancer. Nonetheless, they should still go through screening, and there are national screening programs that I'll talk about in a moment, for the general population that HIV patients should still participate in to make sure they're screened for these common cancers. So what can we do to help you reduce your risk of cancer? Firstly, and probably most importantly, is taking HIV treatment. That's probably the single most important thing, because that's going to lower your risk of AIDS or HIV-related cancers, and it's going to increase your overall survival for all sorts of reasons. That's probably the most important reason. Secondly, seeing your clinic regularly, seeing your team often, reporting any new symptoms, any lumps and bumps, particularly any weight loss, a new hoarse voice, an unusual cough, a change in bowel habit. Just bring any symptoms to the attention of your doctor. Stopping smoking will definitely cut your risk of lung cancer. Very, very important. And having regular checks for the hepatitis virus, particularly hepatitis C, ensuring you're vaccinated for hepatitis B, and cutting down on alcohol will reduce your risk of liver cancers. And these are all very, very important things that the clinic will support you in doing. For HIV positive women, their risk of cervical cancer is much higher than HIV negative women, so it's very important that they participate in annual cervical smear tests to check for early changes of cervical cancer. And some researchers do recommend, particularly for men who have sex with men, to have anal cytology smears or screening to detect early lesions of anal cancer. And this is something that's useful to discuss with your HIV doctor. And not all HIV services offer it, but they certainly be able to refer you to one who does, if that's appropriate for you. So for the general population and for HIV positive patients, it's important to be aware of national screening programs that exist. And it's important that you're linked into these programs so you can benefit from them. So for all women, there's a cervical screening program, which for HIV negative women is every 3 years, but for HIV positive women, we increase that to annually because of the increased risk. Now, for bowel cancer, there's screening every 2 years for men and women between 60 and 74 years. And this is organised through your GP. If you're registered with a GP, you'll get automatically invited. Next, breast cancer screening. This is offered every 3 years for women aged 50 to 70 years old, and again this is done through being registered with your GP. And 2 screening programs which I think are important but are not related to cancer. One is screening for abdominal aortic aneurysms, which is an abnormal expansion of the aorta, which is a major blood vessel. This is offered for men aged 65 to 74, and risks for abdominal aneurysms include smoking and high blood pressure, and having an aneurysm can ultimately be fatal, so it's quite important to be involved in screening for this as well. And secondly, for diabetics, it's important to be engaged with your GP because they will ensure you have annual eye screening, because diabetes can cause serious problems with the eyes that can ultimately lead to blindness. So every year, diabetics should be screened to check the backs of their eyes, their retinas. So these are things that for HIV positive patients it's important not to forget and to be involved in these as well. Now, one of the things that many people fear with getting older is changes in their memory. Again, that can affect your independence, your ability to cope, and doing things you enjoy doing normally. And this can affect HIV patients too. So they may experience memory loss as they get older. They may also experience other symptoms related to the nervous system, such as tremor, changes in their coordination, or maybe personality changes as well. And things to signs to look out for are difficulty learning things for the first time, difficulties with your memory, particularly your short-term memory, and feeling that you're slowed down and you're not processing things as quickly as you could. Other important things are feeling unsteady or dizzy, having frequent falls, tremors, or poor coordination. And importantly, these factors may affect your ability to take your HIV medication. And if you're not able to take your HIV medication, there are all sorts of knock-on effects for your health in general. So these are really important issues to pick up. Your doctor and your GP will obviously ask and pick up these things in your consultations, but it's good to look out for these signs as well. Now, patients who are on HIV treatment, doing well on their treatment, their risk of these issues is going to be lowered by taking effective HIV treatment. So that's a very, very important point to make first of all. If you notice any of these signs, it's good to alert your HIV doctor and your GP, because they can investigate for possible causes. It may be something as simple as a vitamin deficiency, or it may be an infection. But there are a number of things that may need to be done to investigate this, and it's best to let them know as soon as possible. There's several studies to show that eating oily fish 2 to 3 times a week, as well as improving the health of your heart, it can also reduce your risk of memory loss, and it can slow it down. Eating a healthy, balanced diet and regular exercise is also believed to help keep your memory strong, keep your cognition strong, and avoiding excess alcohol and also recreational drugs as well, because these may seriously affect your brain function, particularly in excess as well. Changes in your memory, they could be related to stress, they could be related to anxiety, they could also be related to side effects of your medication. So there's such a wide range of things that could cause it, and it's such an important issue. If you notice things, don't be afraid to bring it on with your doctor, and they can liaise with your GP to investigate you and get things moving. Now, as I mentioned before, as we get older, we're likely to develop more medical conditions. That's just a natural part of getting older. And we're likely to get prescribed more medications. This might be for your blood pressure, it might be for cholesterol, it might be for any number of things. Now, for any older person, that increases the chance that these medications could interact. For an HIV positive older patient, you've got the added fact that you're taking HIV medication, which may also interact with these other drugs as well. And as your body gets older and your kidneys get older, your liver gets older, you may have a slightly increased risk of these interactions happening as well. So in our clinic here, in all the HIV clinics, we've got excellent specialist pharmacists whose job it is to look specifically at the medication you're on and to ensure there's no drug interactions, to make sure we're prescribing medications safely for you. It's important though that your GP knows that you're HIV positive, because they are likely to prescribe you medications. And really it's important for anybody who prescribes you medications to be aware that you're on HIV treatment, because they could otherwise unknowingly prescribe you something that might interact and cause you more problems. Now, there's a huge number of drug-drug interactions, but just some of the common medications that interact with some antiretrovirals are some statins that lower cholesterol, some antacid tablets, warfarin for blood thinning, and very commonly used steroid inhalers and steroid nasal sprays as well. So important to inform any prescriber that you're on HIV treatment to avoid interactions. And there's an excellent website called hivdruginteractions.org that I'd recommend if you wanted to check any interactions yourself or just get some advice. But don't hesitate to speak to your team and your HIV pharmacist about anything you're concerned regarding interactions. Now, what I'm going to talk about now is the other side of getting older, which is the social and psychological factors that may arise as we get older, particularly for patients who are living with HIV. So I read this interesting study called the Hall study, which refers to HIV in later life study, and this looks specifically at social support, mental health and quality of life of people living with HIV who are over the age of 50. Now, this was carried out in London between 2011 and 2013 by a big team led from Keele University. About half of the participants were aged 50 to 56 and half were aged 57 to 87, so quite a good span of patients. Now, in terms of their mental health, most participants reported that their mental health was good or moderately good at least, but 1/3 reported that their mental health was poor. And about half reported their quality of life was really very good, and 1/5 said it was poor. And regardless of what they rated their quality of life was, all of the participants stated that their quality of life was something that was an ongoing project of work for them, that was an active process for them to improve. And some of the examples participants gave of what they did to improve their quality of life were looking for appropriate support for their HIV, both from the clinic and from elsewhere, attending and volunteering for HIV-specific organisations, and reframing or rethinking HIV to reduce its effect or its negative impact on their life. And in reality, in terms of the worries and experiences that patients reported, the older participants reported really many of the same challenges that younger HIV patients faced, such as HIV-related stigma, the difficulties of disclosing HIV, the uncertainty of living life with a chronic condition, and the impact of HIV on work, social relations, sexual and romantic relationships, and financial security. In terms of the challenges that they found regarding their mental health and their quality of life, more specifically to getting older, however, they were particularly worried about HIV-associated stigma, and they were particularly worried about the stigmatisation of older people living with HIV. There was very much a feeling that HIV was considered to be something that you caught when you were young and then maybe you just disappeared, and the fact that you were living older with HIV seemed much more stigmatising for an older person, or inappropriate for an older person, than it is for a younger person. So that was a real worry. There was a lot of concern about the uncertainties, about not knowing what's going to happen to your body as you get older, in terms of the physical changes, the psychological changes, and the social impacts of living with HIV. And I think this reflects the history of HIV, that it is a very young epidemic. It hasn't been around very long, so we haven't had many people who are living so long as we do now. There just isn't that experience. There was a lot of worry regarding the difficulties in forming romantic partnerships as you get older, with the issues around being HIV positive and a perception that other older HIV or HIV positive or HIV negative people would hold very stigmatising beliefs about HIV. So it's a worry that older people might be more judgmental than younger people, so it might be harder to develop a relationship. And there was a perception of a lack of support and understanding for people getting older with HIV, so a feeling that there was a lack in provision, maybe in clinics or maybe in the media, of understanding the issues about getting older with HIV. There were certainly concerns about remaining independent in their later life, issues around social care, how they would pay for it, how they would ensure appropriate support, and the associated issues around disclosing their HIV status as part of that. Concerns regarding disclosure and fears of rejection, particularly when you're starting to develop a romantic relationship. And there were certainly financial worries about feeling alone, having difficulties with pension, and being fearful about the future. So one thing that was quite strongly brought out in this study was that although the participants did, in the whole, have reasonably good social support and family support, a lot of them reported that they really needed social support from individuals who had experienced HIV themselves. And this notion of peer support from people who had lived with HIV, who had a deep understanding because they lived it experientially. And a lot of participants reported that they gained a lot of help in terms of their quality of life by attending HIV organisations and volunteering in particular with these organisations. They felt that this reduced their feeling of isolation, provided them a safe space just to be or talk, and allowed them an opportunity to give back and support others. So we'll just do a couple of slides now on tips to stay healthy, both physically and mentally. In terms of tips to stay physically well, I think it goes without saying, we would really encourage you to see your HIV team regularly for your appointments, for your reviews, for your routine blood tests, because this will allow us to pick up early any possible changes in your health and really act on them quickly to make sure we keep you in the best possible health. If you yourself notice something has changed about your health, don't hesitate to ring us up and let us know. And we can see you earlier, we can advise you over the phone, we can get things moving. It's really important, once you're on your HIV medication, to adhere well to your medication, to keep taking it every day correctly. And if you're worried about taking the medication, or you're worried you're not taking it well, or you have concerns about it, please speak to us early and let us help you with that. Don't feel like you have to struggle with that by yourself. We would recommend informing your GP of your HIV status, and I know that cannot be straightforward for some people, and that does need some support and help. But from the point of protecting your health, we think it's really valuable for your HIV to be disclosed to your GP so he can prescribe correctly without fear of prescribing medicines that might interact with your treatment, and that they can be vigilant with your health because they're aware of your status. They'll think of other things knowing that you're HIV positive if you come to them with a medical complaint. And really making the best use of your GP services for general health checkups, particularly things like diabetes, blood pressure, weight, to make sure that you're being involved in national screening programs like bowel cancer screening, mammograms, screening for abdominal aortic aneurysms, and for things like mental health, for anxiety, depression, all of these things. GPs can offer excellent treatment and onward referral and support, particularly with mental health issues. And we always bang on about a healthy diet. As you know, lots of fruit, veg, not too much salt, some oily fish, low in saturated fat, and some regular physical exercise in whatever form that you enjoy, really. We do recommend cutting down or stopping smoking if you can, because it's such a powerful factor in affecting your health, particularly with cardiovascular disease, and drinking alcohol to moderation as well. That's also very protective for your health. And in terms of your well-being and keeping well from a psychological point of view, again, see your team regularly. If there's any worries, you can speak to any one of us, whether it's your doctor, your pharmacist, the health advisor, whoever it is that you're in contact with, and we can always refer you to the right person. Particularly your doctors and your pharmacists will be able to help you if you're worried about your medications, you're worried about taking them, you're worried about side effects. And our health advisors are really fantastic at giving support and advice, whether it might be on sex, relationships, drugs, alcohol, disclosure of HIV status, your emotional well-being, and referral for things, very important practical things like finances, legal issues, housing issues, and they can refer onwards for more formal counselling if that's necessary. They can also offer referrals and signposting to voluntary agencies that may help with a lot of these practical issues, and also peer support for people living with HIV as well. And as I've said before, really use your GP. They're really a fantastic resource, and particularly if you're concerned about mental health problems and you'd like to get more you'd like to get more information and possibly access some treatment and referral, your GP is a great place to start with that. And obviously look out for our clinic website, look out for our notice boards, ask any of us if there's any events going on, and feel free to get involved with our patient forums and our patient events, and we'd love to see you there. I thought I'd just end with a quote from another HIV patient that I really liked. I thought this is a really, really lovely, positive quote. I thought I would be grown up when I was 30. I'm now 58 and I've still not finished the growing up thing. I'm still thinking, loving, making terrible romantic and lifestyle mistakes, but I'm still alive. And despite the burgeoning belly and pelican chins wobbling in the wind, I still wear young man's clothes, still go out with my friends, still laugh and cry. I'm very glad to be older, well and alive. Thank you very much.